P scenario 3, Casey. Date of birth 1/2/1997, male. Insurance Blue Cross Blue Shield. PMH, bilateral PE tubes at 2 years of age. Vaccinations up to date. SH. Casey attends the 10th grade at a local high school and is on the honor roll. He resides with his mother and father in an upscale residential neighborhood. Casey just acquired a driver license and works on weekend at a grocery store. He has been dating a fellow high school student married for 3 months. Reason for visit, wall child check. Question number 1, proceed with the interview. What subjective information would you attempt to elicit? Proceed with the physical examination. What objective information would you obtain? 3, what is your treatment regimen and follow-up plan? Hello, Casey. Hi. My name is Karen. I'm a nurse practitioner student, and I will be doing your wall child examination today. All right. Before I get started, I would like to get to know you a little bit better.
Okay.
All right. Tell me a little bit about yourself.
Healthy, 15-year-old.
Okay. How is school?
School is going okay.
Okay. Would you tell me a little bit more about what you do in school?
Well, I think I am in honor roll, something they say, and I play for the soccer team at school.
Oh, good. My husband also plays soccer, so it is an interesting sport. In the last 3 months, have you had any injuries?
No.
Okay. Have you had any headaches?
Mm-mm.
Are you allergic to any medicine?
No.
Okay. Any earache?
No.
Eyes, vision problem?
No.
Any nasal bleeding?
No.
How about your mouth? Do you have any sores? Does your throat hurt?
No.
How about you? Do you have any toothache?
No.
Okay. Whenever you're playing soccer, do you get out of breath? Do you get shortness of breath?
Mm-mm.
Do you have any chest pain?
No.
Okay. And are you eating okay? How's your appetite?
Mother says I eat too much.
That's typical for a 16-year-old. That's the growth spurt, I believe. Okay. Does your stomach? Do you have any pain in your stomach?
No.
How's your bowel movement? How would you describe it?
Well, I go pretty much every day. No problems.
Okay. And whenever you urinate, does it burn?
No.
Have you noticed any foul smell?
No.
Any yellowish discharge?
No.
Okay. Outside of school, do you have any other activities? Do you hang out with friends?
Other than soccer, and hang out with a lot of my teammates.
Okay. Do you drink?
No, I don't.
Do you smoke?
Never.
Do you chew tobacco?
No.
Okay. Well, that's all good. Since you do have friends, your friends may be doing those type of things, but I want to let you know that if you find yourself in a situation where your friends are drinking, make sure that you do not get in a car with them.
Okay.
If you choose to drink, which is I highly not encourage it, but if you do, just make sure you do not drive.
Okay.
Call your parents or get somebody who has not drank and ride with them at home.
Okay.
Since you also just got your driver license, make sure that you always have your seatbelt on for safety. And make sure anyone that is in your car also have your seatbelt on. Okay?
Okay.
All right. Since you also have a girlfriend, right?
Yes, I do.
Okay, with your girlfriend, have you had any physical intercourse with her? Have you ever been in any physical intercourse with her in the past?
No.
All right. That's also really good. We highly encourage abstinence. Abstinence is where you don't practice any sexual activity. We provide guidance just in case whenever you feel like you need to, you want to take that role on becoming sexually active, you can always call us at the clinic and we can provide you with the right information. You can also talk to your parents about it, and they can help you. But if you don't feel comfortable with that, you can always come back to the clinic, and any of the providers can help you with that. Okay?
Okay.
Well, I'm going to go ahead and start with the physical examination.
Okay.
All right. First, I'm just going to look at your skin. Skin is warm and dry. Turgor is good. And then I'm just going to look at your head and your hair. Hair is well distributed. Texture is normal. There's no brittle. And then on your scalp, there's no lesion. There's no bruising. And I'm going to palpate, feel your ear. The ears are symmetrical. There's no lesions. And then I'm going to look at your eyes. It's clear conjunctiva pink. And then your nose is symmetrical, is patent. Mouth is moist and pink. Look in your mouth. Can I stick your tongue out? Can you swallow for me? Can you say ah?
Ah.
All right. I'm going to do the, I have something in my hand. I'm going to have you smell for me.
Okay.
All right. And then I'm going to do a vision test on you, okay?
Okay.
Just tell me what's the lowest number that you see on there with your eyes covered. All right?
Yeah.
Okay. And while your eyes are still covered, I'm just going to have you remove your hand. Okay? There's no deviation. And then I'm going to shine a light in your eyes. Pupils equally reactive to light. Okay, I'm going to put my finger up and I'm going to have you follow it. Okay? Okay? For the smell, I assess cranial nerve number 1. And for the vision, I assess cranial nerve number 2. And then with the vision also, I assess cranial nerve number 3, 4, and 6. And then I'm going to assess cranial nerve number 5. Tell me if you feel dull or sharp.
Dull.
Okay? Now I'm going to assess cranial nerve number 8. That's the hearing.
Yeah.
Okay. All right. In your mouth, I had Casey swallow and do the ah and stuck his tongue out, and I assess cranial nerve number 9, 10, and 12, and I'm going to assess cranial nerve number 11. How do you stick your tongue? Okay. All right. Well, now I'm going to go ahead and listen to your lungs, okay?
Okay.
And I'm going to put my stethoscope under your shirt. And I'll also listen to the back. Going under the shirt. Good. All right. I'll have you lean forward for me while I listen to your heart. This is at the aortic and pulmonic. Go under here. Ebbs point. Mitral valve. Tricuspid. Then the mitral. I hear no murmurs. Heart rate's regular. All right. I'm going to have you lay back for me while I listen to your stomach. Before we do that, let me check your neck. There's no lymph nodes. Would you go ahead and sit for me, please? I want to check your neck and see if there's any deviation. There's no trachea deviation. All right, I'll have you lay back down for me again. I'm sorry for having you go back and forth. First, I'm going to listen to your stomach. Listen for your bowel sounds in all 4 areas. And now I'm going to percuss. Do that in all 4 quadrants. And I'm going to lightly palpate. Tell me if you haven't feel any pain.
No pain.
Okay. Now I'm going to do deep palpation. While I'm doing that, I'm going to try and assess for the liver, which I shouldn't. And also do for the spleen, which I shouldn't be able to. And then assess for the kidney, which I shouldn't feel that either. All right. Casey, I'm just going to have you sit back up for me. All right. While we're sitting, I'm going to do check for DTRs. Start from the brachial. And then with knee. All right. Oh, check for the Achilles. All right. All right, Casey, I'm going to have you stand up for me with your eyes closed. Stretch your arm out. All right. Good balance. All right. And now, with your eyes still closed, I'm going to write something in your hand and you tell me. Okay. And I'm going to put something in your hands. I want you to identify that for me.
Jeez.
All right. Would you step forward for me a little bit? All right, good. Okay, well, I'll have you sit back down for me. All right, that completes our examination. Everything looks fine. So, just before you leave, I want to talk to you a little bit about the STD. I'm not sure if we talked about it, but there's also HIV, HPV, and herpes. With HIV, there's no vaccination for that. But with the HPV, we do have the Gardasil, which is a vaccination. We do offer it at the age of 11. And
this was for girls.
boys can also have it. It's not only for girls, it's also for boys. And that's what a lot of people do not know, that boys can also have it. And that's to help prevent the HPV virus, and which causes genital warts. And in girls, it will cause cancer. It will lead to cervical cancer. So we highly encourage families to get the vaccine. And this is something that I'm going to talk to your mom about. And then I'm going to give you a brochure for you both to take it home and look at it, read about it, and talk it over and make a decision. Okay?
Okay.
All right. For now, I would like to see you back in a year's time.
Okay.
And if you have any questions before that, you can always call me, and I'll be more than happy to answer any of your questions, okay?
Okay.
All right, Casey. Well, thank you so much, and I will see you later.
Thank you.
Thank you.
All right.